Boleh. Okay,
Okay,
Assalamualaikum, very good morning. Okay. Boleh Nina?
Done.
Okay, boleh proceed?
Yes.
Hello? Okay. Okay, thank you, Nina, for your kind introduction. Assalamualaikum, very good morning. Thank you for attending this neuroemergency CME classes. Today we have two topics regarding the decompression illness. First topic will be delivered by Lieutenant Colonel Dr. Muzammil Ozair. Topic is neurological manifestation related to decompression illness. Lieutenant Colonel Muzammil Ozair is emergency physician for Hospital Angkatan Tentera Terendak Melaka, followed by lecture by Professor Datuk Dr. Nik Ishamuddin Nik Abdul Rahman. The topic is regarding the hyperbaric therapy management in decompression illness. He's a director and also senior consultant emergency physician of the Hospital USM. Okay, before we start with our first lecture, let me introduce to you our first speaker. He was my senior during my undergraduate and also postgraduate training. Lieutenant Colonel Dr. Muzammil Ozair is graduated from Hospital University Science Malaysia for medical degree in 2007 and obtained his master degree in emergency medicine from the same university in 2016. He completed his housemanship in 2008, I think from the hospital Alostar, Kedah. And he was posted in the 2nd Medical Battalion as a medical officer and training officer and was deployed to the UNIFIL mission in 2009. He was later appointed as a senior medical officer in 817 Resat Air Force College from 2010 till 2012. He underwent 4 years master program and later was posted to Armed Forces Territorial Hospital in Kota Kinabalu from 2016 to 2020. During his stay in Kota Balu, he was appointed as head of department for emergency medicine and also the hyperbaric department. Later, he was posted as the head of department of emergency and trauma department for 94 Armed Forces Hospital, Terendak Melaka. He was exposed to a wide range of services from Army, Air Force and also Navy. His special interest in pre-hospital care involving those tri-services. He was involved with disaster relief and rescue mission, inclusive in Kelantan Air Rescue Mission. I think it's about 2014, around 2014, if I'm not mistaken. One Ocean Harmony assaulted mission and Lima Water Surface and Air Rescue Reviewer. He involved directly with development of diving agency guideline for Sabah State, and he was sent to USA under United States Army School, Texas for tactical combat and casualty care courses. Since then, he had reviewed the current guideline and emphasized on update and evidence-based practice, especially in managing the hyperbaric patient. Okay. Without any further ado, I would like to invite Lieutenant Colonel Dr. Muzammil Ozair to deliver his lecture. Sir, the floor is yours.
Thank you very much, Dr. Hafiza. Dr. Hafiza is my wife, a good friend back in undergraduates, and I will say that he is one of the good colleagues, best colleague to work with. And thank you for a very kind introduction. And thank you very much as well to Dr. Nina. She messaged me earlier and she said that if I didn't give this topic, he won't find any other person from the military. But Nina, I'll try my best to feed the hunger of knowledge about this, what we call the decompression illness with the neurological manifestation. Let me share my slide with you guys. Okay. Can you guys see the slide? Fiza, okay, good?
Okay, boleh nampak?
Boleh nampak, eh? Okay, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh once again, and good morning. Thank you very much for the kind introduction again. My name is Dr. Muzammil. I'm a emergency physician that currently based in the Army base. I used to work in the Naval base and used to be the head of department for the hyperbaric unit back in the Armed Forces Territorial Hospital, Kota Kinabalu, in 4 years there. So we saw a lot of cases related with the diving emergency, and we would like to share. I would like to share with you guys what we call the clinical findings of those patients that presented to us earlier. So just to share with Afiza and Dinam, I might be posted again, inshallah, next month to another center, which is training center for the Armed Forces Health Institute. Then it's going to be a different world after this. No more like dealing with patients a lot, inshallah. Okay, so as a disclaimer for this presentation, I have no conflict of interest with any company related with the hyperbaric service provider. And this is what we call the case sharing platform. I have to declare that we have a limitation as not so much photos related with the investigation like CT brain finding or the MRI finding. But we do keep a certain report as I got from my staff from the previous department back in Kota Kinabalu. And I would like to acknowledge certain people in the Malaysian Armed Forces stakeholders for the opportunity that given to me to explore my interest in the certain fields, as well as not to forget about the hyperbaric and the diving medicine. And I would like to acknowledge as well the only submarine medicine subject matter expert in the Malaysian Armed Forces Service, which is Brigadier General Dr. Rushdie Abdullah, with his guidance and share of the wisdom. And not to forget one of my good senior colleague, the CEO of the Camofins Club. He is the only emergency physician with the background of the diving instructor. He's a certified diving instructor. He's a Colonel Dr. Hafizi Abdullah. He had this what we call a lot of sharing experience, and that's where we learn with each other. And not to forget the currently head of department in the Mohd Hospital for the hyperbaric unit, Major Dr. Hafizul, which is he is also an emergency physician. So, and not to forget the whole emergency families, whether coming from the Ministry of Health, or Ministry of Education, or the Ministry of Defense. So when we talk about the diving emergencies, when we talk about the diving environment, there are a lot of beauties in the what we call the seafloor. So we might share the basic understanding, the principle, and the manifestation, and how this disease, how these clinical conditions develop. So with that, I will go with this main three outline. It's going to be a very simplified lecture. Hopefully, it can enhance your what we call promote you to learn more about this the diving emergency. So looking into this, I'll go with the physics of the gas law a little bit because that is the principle and the basics that we have to understand before we go further to look into the clinical manifestation of the decompression illness, and a little bit on the bubble effects. And I will share about the three cases that presented to the Kota Kinabalu Armed Forces Territorial Hospital back when I was served there in 2016 till 2020. So looking into this, the principle behind it, we always talk about the pressure changes. When it comes to the diving environment, it's going to be slightly different when you talk about the ambient area. So if you go by flight, and once you reach to the extent of the 18,000 feet, that's where you halve the absolute pressure from the surface on the ground. So but then when you talk about the diving environment, in the diving environment, as you go 10 meters deep, is gonna be you have this one increment, or we call the double from your surface. Any further 10 meters depth, is going to add another one by the absolute value of your atmospheric pressure comparison. So looking into this, we're talking about in the diving environment, it has the what we call the prone to develop the compressive condition. And when it comes to the word decompression, it means that when the person being in the high pressure environment to the lower pressure environment, that's where the decompression state, and most of us, we encounter it. But then when it comes to the certain pathological state, what we call the patient, the normal physiology being overwhelmed with the process, that's where you start to have this, what we call the decompression illness manifestation. And I will share with you guys about the certain gas law. And here are the basics tables that for us to understand before we go further deep with the understanding about the diving environment. So as we go, any 10 meters depth, there will be the added by 1 atmospheric pressure to the environment. And looking into this as well, there is a clinical state condition, what we call the bubbles size is going to be relatively the difference, and this is something that what we call the gas law related, which is being described by the Boyles. So this is the basic principle for us to understand, okay? Because with these numbers later, I will show to you guys about the little bit of the simplified calculations for us to understand why the disease manifests among the divers. So there are 2 people that I would say the pioneer of the gas law. There are a lot of other people, but the Boyles and Henry are the 2 main people that facilitate the basic principle understanding of the gas related or the bubbles formation among the high pressure environment. So let us go with the first gas law. This is what we call the Henry's law. Some of us might love physics, some of us might not, but for the divers, for the hyperbaric doctor, we have to go with this, the understanding of this Henry's law principle. So what did Henry's mention? I'll try to go with the simplified understanding so that all of you can follow with the pathogenesis of the disease. The first rule we have to understand about this, the in-gassing effect. Whenever you go to the high pressure environment, there is a condition where you call that the inert gas that is not involved directly in the human physiology will be pushed to be dissolved in our tissue as well as in our bloodstream. And as you go longer, okay, as you go longer in that high pressure environment, this inert gas become what we call the saturated in the whole body. So this is what we call the in-gassing theory effect. The in-gassing theory effect is further being described by one of the famous physicists and the chemist, Dr. John Scott Haldane. Some of us might learn about the Haldane's effect. So Haldane's describe about this, what we call the dissolve of the certain gas at the certain compartment. But then it also being described about the way it can be out of, or what we call when we have the in-gassing effect, we also might have the out-gassing effect. Scott Haldane also described that the tissues have the multiple compartment, and there are certain part of the tissue that can have the what we call the fast effect, and some tissues might have the low effect. So point to take note from the principal understanding of this is when you go to the deep dive, meaning that you are encroaching yourself with the higher amount volume of the partial pressure of the gas, of that inert gas, it can saturate, the saturation can occur in the fast tissues easily. This is when you talk about the short period and the deep dive. Where do we call these fast tissues that we talk about? The blood, the brain, and the spinal cord. where is the tissue that have the good blood supply. This is where the fast tissue is, and the fastest tissues in our the fastest compartment in our tissue is actually our lung. And when you talk about shallow dive, meaning that rather than you go for deep like 30 meters, you might go to the 6 to 10 meters depth. So that's what we call the shallow dive. And the saturation occur mainly at these low tissues. It does not involve much with the fast tissues dissolve. So looking into this, it's most likely like a ligaments, like joints. So these are the area where the saturation occur. And when you talk about the long period and deep dive, the saturation occur everywhere. So these are the principal understanding that we have to understand first when we talk about the physics behind the in-gassing theory. So then what as I mentioned earlier, as we go deeper, the higher the surrounding pressure and the higher of the gas pressure that we are taking. So like example, our inert gas, we know that like nitrogen, in a compressed air, in what we call in a normal air that we breathe, we got about 21%, or make simplified calculation, 20% of the oxygen and about 80% of it is a nitrogen gas. So looking into that nitrogen, so at 10 meters depth, where you know that the total absolute pressure at that depth is about 288, where you are now breathing the previous nitrogen of the 80%, now they become the 160%. Or looking into it, we calculate it as a nitrogen of the 1.688. So this nitrogen at 1.688, it will prone to dissolve the gas in the whether the fast compartment or the slow compartment. So looking into this, the dissolve, it will lead to the in-gassing effect. So these are the compressive state. When we talk about decompression, when we talk about the pressure changes, when it comes to the high pressure compartment to the low pressure compartment, here we have to understand that before I go towards that, we have to understand whatever amount of gas that being in a state of the air, it will also the same amount will be in a solution, in a gas in a solution. So these are the Henry's description. Henry say that whatever gas, the amount of gas being stated in the gas form, the same amount of the gas will be in the dissolved form. So when you give more nitrogen, when you breathe more nitrogen at the 10 meters depth where you have a 2 absolute atmospheric pressure, so at that moment you are going to have more dissolved nitrogen. So these are the principle, the first principle that we have to understand. Okay, when it comes to the changes of the pressure, the amount, the basic things that we can see is like using our carbonated drink. So when you open up your carbonated drink, the first thing that you're going to see is the bubbles start to form. So that is what we call the situation where you have the high pressure towards the low pressure compartment, the release of the gas will form. It has two theories behind it. One of the theory is about the dissolved theories, which is the currently mostly being used. Another thing is a supersaturation theory. So I'm not going to go do details on that. But then looking into the Henry's principle, Henry said that the gas in the dissolved form should be the same amount of the gas in the ambient, or we call the air. When you have the decompressive state, the sudden release of the what we call the dissolved form of the gas will form the bubbles to facilitate the easy release. So these are the first principle that we have to understand. So looking into this, anything that comes with the nitrogen formation, nitrogen bubble formation in our human body, when it comes to the state where the people go to dive from the high pressure compartment to the low pressure compartment, meaning to the surface. So anything that they manifest from the bubbles, we call them as a decompression sickness. So we have to understand that is the first principle of understanding when you talk about the diving emergency. And the next part of it, we talk about the Boyle's law. So Boyle's law, it states that at a constant temperature, the pressure is indirectly proportionate with the volume. So in a simplified calculation, it just mentioned P1 V1 is equal to P2 V2 at a constant temperature. So looking into it, Boyle's describe about the one that you see at the right hand side of the screen, where at the surface, when you have the 60 mils volume at 10 meters depth, the volume is gonna be half, okay, because of what we call the pressure by rise, it will reduce the amount of volume. And if you go for the 20 meters depth, like a 380A, from the 60 now divide by 3 is gonna go with the 20 mils volume. So these are the Boyle's effect. The issue with the Boyle's is not about when you talk about the people went from the 40 meters to the 30 meters, but the dangerous situation when it comes to the Boyle's description is about having the sudden expansion about more than half, especially from those who went to 10 meters to the surface. So when the air is entrapped in a closed circuit, the condition can lead to what we call the overexpansion. It is being described by Boyle's, especially in those involving with the breath hold ascent divers. It's not about breath hold diving, it's about the divers which when they breathe at the 10 meters depth and they become panic because of the certain emergency, like maybe they saw shark coming towards them, they saw like we call it underwater crocodile that attacking them, or the predators attacking them, or perhaps in a situation where the equipment failure or malfunction, some inexperienced divers might go through what we call as a breath hold ascent. At that moment, they are actually exposing themselves towards the micro rupture of the alveoli from the results of the overexpansion, the double expansion of the previous amount of air that they've took at the certain depth. So these are the clinical conditions that can lead to being described as the pulmonary overinflation syndrome. So all these are the two conditions that mostly involving with the bubble formation inside the human body among the divers. And when we talk about the bubbles itself, unique thing about the bubbles have what we call the certain effect. So in summary, it's that, and in summary of that physics, okay, decompression sickness mainly describe about the Henry's law principle. And when you talk about pulmonary overinflation syndrome, you talk about the Boyle's law effect. So these are the two laws that related with the bubble formation. For whatever reason, if let's say you encounter the decompression sickness or the pulmonary overinflation syndrome, still the treatment is about the recompression oxygen therapy. I'm not going to go to detail on that because I'm sure Dr. Nick will present on that about the treatment. So now let us talk a little bit on the bubbles effect. It's as simple as I can say that bubble can tear everything. Okay, one unique thing, bubble, it can have the dissection effect. The bubbles is actually quite dangerous when it comes to the overexpansion bubble. Okay, the bubble with the micronucleus inside, like the nitrogen bubbles. The bad things about it is it can be like a scissors inside our human body. So the bubbles, despite we know if you poke it, it's going to be ruptured easily, but it does not work in that way when it comes to the bubbles inside you. So we just simply classify them into the two ways of it. which are the direct effect. When you talk about the bubbles that coming from the anything that when it comes to in the circulation that away from the lung, especially those in the pulmonary overinflation syndrome, the bubble will escape through the pulmonary vein and enter to the left ventricle before it will go further to the aorta and the whole circulation. One of the things that the manifestation is what we call the bubbles will lead to arterial gas embolism, especially to the cerebral circulation. That is where we diagnose them as CAGE or cerebral arterial gas embolism. And some of the bubbles might enter towards the venous state, but mainly it's mostly involved with the nitrogen bubbles. And when the bubbles being dissolved in the tissues, and it should have the ability to be what we call re-enter the circulation, but then in a state where the timing or the duration of that process being overwhelmed by the amount of the bubble or perhaps the size of the bubble, it will lead to the tearing and stretching effect. And that's where certain bubbles, it can tear like your skin, and I will show a little bit on that clinical finding. And bubbles also can lead to what we call the indirect effect. By theory, it will lead to the platelet activation system, but then still when you talk about the platelet activation system, it still does not promote us to give an antiplatelet to the patient who is having the decompression illness. And part of it is about histamine release. This indirect effect of histamine release, there's the hypothesis behind it. It's being possible because of some of the divers have this pulmonary edema manifestation. So some of the theories saying that the pulmonary edema related with the bubbles itself. Some theories say that the pulmonary edema is related with this histamine release, and those are the clinical manifestation. Those are the effect that can have from the effect of the bubble. So how do they manifest? In simplified way, when you talk about among the divers, so when you talk about the divers, we among diving doctors, or what we call the clinical doctors, we go with the 4 main groups of the clinical manifestation, which we describe them as a creep and bend. Bend means when you talk about the joint pain, inability to move the joint because of the post-diving activity. That's where we talk about the bend manifestation. That's the original word being described among the divers when they presented to the hyperbaric doctor back in certain developed countries. That is the original word. The bend means like the decompression manifestation. And we also can have this creep manifestation where you feel like something creep under your skin, where some of the patient might have the skin crepitus, okay, towards the unfamiliar area which are away from the neck, like those yang dapat pulmonary overinflation syndrome. Sometimes you may have the skin creeps over the lower limb, sometimes over the torso, and sometimes over the upper limbs. These are the bubbles being formed beneath of the skin over that region. Okay, and another manifestation they may presented with a choking like sensation. It could be related with the pulmonary edema or the coronary occlusion. So those are the manifestation, and not to forget about the instability and weakness. So it could be something to do with the brain and something to do with the spinal cord. So those are the clinical manifestation of the bubbles effect. We talk about the tearing and stretching. Anything where the bubbles being formed, it can what we call damage that local environment. And we talk about the circulation, when it blocked, it will lead to what we call the gas embolism. So as a revision, before I go further towards the case presentation, when you talk about the short and deep dive, meaning that you go to the, not you yourself, perhaps the divers went to the deep environment, and they talk about the short duration, because some of the divers, they're aware that at the deeper area, they can't go longer because they want to avoid this super saturation condition. So most of them will have this, the fast tissue saturated gas. That's mainly over the blood, brain, and the spinal cord. When you talk about the long and shallow dive, mainly it will involve with these low tissues like joints. When you talk about the long and deep dive, the saturation can go anywhere. So looking into this, okay, looking into those three conditions, at least it can give you an idea when it comes to the approach to the divers. When they presented with the decompression illness, it can lead you to trigger about the where the most probable clinical manifestation that could be related, okay, whether they're masking it or they present with the genuine finding. So let us go with the case discussion number one. It's going to be a simplified case discussion. Okay, this is a true case that presented back in 2017. I can't show the photos of the divers, but some of you that work in Sabah during that time might know about this case. We have the 27-year-old Bajau Laut, which is our common our common customers that presented to the hyperbaric center. Those especially involving with the compressor dive. What does it mean by compressor dive? Meaning that they are using compressor on the surface or in their boat, and they're using the hose down, and this is what we call the surface supply breathing apparatus. Meaning whatever gas that they're going to use from the compressor in their boat. So what happened towards that dive activity, based on the area where the Bajau Laut went, the dive depth, the floor is about the 30 meters depth. So the presumption at that moment is about the dive around the 30 meters depth, and the duration was unknown because based on the history by the partner that went with this gentleman, the duration is not that sure, but he was told that it could be more than 30 minutes duration. So what happened at that moment, they have this what we call the compressor failure. One of the danger thing about the the surface supply, whenever you encounter difficulties at the surface where the malfunction of the equipment and everything, you are actually prone to rapid ascent to the surface because we are human. We don't have gills to breathe. So what happened when the patient reached to the surface, he was suddenly blacked out. So brought in by the boat and sent to the nearest hospital. And I will say that one of the management done in the one of the hospital in Sabah by our colleague from Ministry of Health, they did a marvelous and excellent job. They intubated the patient at the first encounter, start the drips, and then the normal resuscitation process. And not to forget, they contact the nearest hyperbaric facility to get the earliest treatment as possible. And this patient received within 24 hours from the onset of the illness to the first, I would say that the referral area to the door of the hyperbaric facility within 24 hours of care. And that patient underwent multiple therapies with the clinical hyperbaric. I won't say about the tables that being used, but then luckily this case, patient recovered. And we were able to extubate the patient after the 2 sessions. And this patient have the what we call end up with the permanent weakness over the right arm. Based on the notes and the document, it say that okay, this patient have the hypoperfusion area over the brain area. So related with these divers. Okay, he went to a deep dive, and it was a long duration. Anything at the 30 meters depth, most of the divers, they will go there about the 10 to 15 minutes. They won't spend a lot of time at that depth because they know they're exposing themselves. We have this deco time. So, but then for these divers, I would say that the compressor, bajau laut divers, when he went there for quite a period of time, the bubble nucleus formed everywhere. So the bubbles is actually everywhere. And another issue is about when he rapidly ascend from that 30 meters depth to the surface, we have this inadequate outgassing timing. Our tissue will outgas itself. That's where the diver's slow ascent, it will facilitate with the outgassing process so that the lung can compensate and the bubble will be removed from the body. But then in a case where the rapid ascent, it will lead to the principle that I mentioned earlier in the first presentation, the decompression effect, the Henry's law, the bubbles start to form and the bubbles have this effect over everywhere. So this patient is having the cerebral arterial gas embolism with the permanent damage on the weakness of the right arm. So I'm sure that some of you guys that work in Kota Kinabalu know about and remember about this case as well. So now let's go to the case presentation, case discussion number 2. Here's another interesting case. We have the dive master. Okay, some of you might know about this case. They actually went by partner. They are not the single, but I just choose one of the case, not both cases. The 25-year-old gentleman, he is a dive master and using the scuba set or self-contained underwater breathing apparatus and using the compressed air only, meaning that he does not use the premixed solution like what we call the heliox or the trigas or the nitrox preparation. He just used the compressed air, meaning he got the 80% of the nitrogen and the 20% of the oxygen. So looking into this dive master challenged himself, go to the deepest area possible at one of the most beautiful dive site in Malaysia. Okay, I won't tell about the detail, but he went to the 70 meters depth. It was a touch and go dive. Usually at about 50 meters depth, our breathing gears, you know that it's compressed a lot of the volume. So what happened, it was like you just breathe in a very minimal of air, and most of the time you are easily out of air by any time. So at 70 plus meters, we just mentioned 70 meters, it was actually deeper than that. He had this what we call out of air condition. It was a touch and go dive, like they go to the maximum depth. It's not the breath hold or the free dive, it was with the scuba set. So what happened was at that moment, at that deepest depth that he went, he suddenly feel that out of air condition. And what happened subsequently from that deepest depth, he went to the surface rapidly. And on the surface, immediately, he said to the boatman with his colleague, both of them, there are two of them, I can't sense my lower limb anymore. I can't move my lower limb anymore. And he can't walk at all. And he had this bilateral lower limb weakness. And the first thing the boatman did was put on oxygen and send the patient immediately to the hospital. There was a delay because the place where it's occurred from the hyperbaric center that capable of handling the case is quite a far distance. So these divers presented to our door after 48 hours. So the issues related about this, let's recap about the duration of dive and the depth of the dive. He went to a deep dive, obviously more than 30 meters. The duration was so short, so most probably he involved with the blood, brain, and the spinal cord. And this patient have this, what we call the spinal cord DCS, and the level involvement at that moment was about T10 area. This patient underwent multiple therapy, and what we call, he also underwent the in-water physiotherapy for the limb strengthening. And his case, it was back in 2018, and in 2020, he sent a photo that he just get married. So luckily for him that he recovered fully from those manifestations. However, because of the certain money-related issue, the patient did not able to request for the MRI of the spine, MRI of the spinal cord. We were unable to determine the exact pathology appearance of the by looking into the neuroimaging aspect of it. But then it was a case where you found that there is an obvious at the level of T10 and below, there is a loss of function, and he recovered, alhamdulillah. It's not by us, it's actually by permission of God. So, and he get married in 2020, and I received a photo of him, but I didn't have the what we call the clearance to share his photo. I would love to share his photo with you guys, but that's what we call the dangerous of challenging yourself. And the case discussion number 3 is about our 45 years old Bajau Laut, also a gentleman using the surface supplied breathing apparatus. They're shooting for fish around the 50 meters depth. So at that moment, okay, we were told that he went to more than 90 minutes. That's what happened among Bajau Laut. Some of them, they go for a long period of time. Upon ascent, it was initially asymptomatic. However, when he at home, he started to feeling joint pain and vomiting. And this case presented to, I think, Queen Elizabeth Hospital, and he had this what we call the hip joint pain. Despite we told that initially our assessment to say this is mostly just joint, but then in the recommendation, anything that come with the hip joint should be treated as the spinal DCS. So as truth it is, it was progressively become weak over the bilateral lower limb. So this patient, he went for the shallow dive and long duration. Delayed presentation, but it was a progressive. Okay, so we have a problem to determine whether the pain that lead to the weakness or the weakness is actually separated from the pain. But then we put the patient into the treatment facilities where the hyperbaric chamber. It was done within 24 hours of the onset, and alhamdulillah, patient recovered fully. So these are the things that I will share with you guys about the diving emergency. I think with that, for the organizing committee, that's the simple things that I can share with you guys about the principle, about the basics, about the how to understand why they manifest in such a way, and how does the clinical manifestation. And those 3 cases is actually the true cases that presented to the Ministry of Health Hospital when they have the last what we call collaboration with the hyperbaric department in the Sepanggar. So we have that opportunity to deliver the treatment early to the patient, and those patients is actually recovered quite a significant value. And some of them have this what we call the permanent disability, but then those are the 3 cases that managed to share with you guys about the uniques on the manifestation as well the importance of the treatment. I won't touch the detail about the treatment because I'm sure Dr. Nick will share with you guys after this. I think with that, I would love to give the microphone back to our excellent colleague, Dr. Nur Hafizah Ciani. Thank you.
Okay, thank you, Lieutenant Colonel Dr. Muzammil, for your very wonderful lecture. Actually, it's eye-opening for me also because I never encountered any patient with DCS before. I think there's one doctor want to ask question, Muhammad Anas. However, the question is not completed yet in the chat area. So Muzammil, sorry, I think I have one question to you. For a center that like me working in northern region in Kedah, I think if the diving spot is not popular, I think the nearest they can go to diving in the northern region is in Langkawi.
Pulau
But I'm
Payang.
not sure regarding yes, I'm not sure how about the depth at that area.
Maximum is about 20 meters.
20 meters, okay.
Yeah.
Is it because it's quite far from any hyperbaric center? I think the nearest in Penang is in a private center. For the government facility, I think the nearest is in Lumut, if I'm not mistaken. What else for the front for if patient we encounter patient with possible DCS in emergency our emergency department? What
Yeah,
else we can
transfer.
offer to patient other than giving oxygen and also hydration before we construct?
Those are the two things that will enhance the recovery and facilitate the recovery. Drips and I'll ask the patient to rest, drips, and not to forget about the oxygen. You try to go with the higher fraction of the oxygen as much as possible.
Can I know how about the interface? Enough with the high flow oxygen, or maybe we need to give higher, such as CPAP, or
if you can go with the nearest of the FiO2 of 1, that's the wonderful things. And what we did back in Sabah in those days, we come to the recommendation at least 6 hours duration of the high flow oxygen if you have the difficulty of transferring the patient. And we found that with that duration, those come with the mild DCS had a good recovery. And some of them, when they presented to the hyperbaric center, they actually don't have to pursue with that to go with the clinical hyperbaric anymore. But then it is subjective opinion, is just based on the what we call the experience sharing. And I saw that Dr. Nina asked something.
Okay.
Okay.
Banyak question, sorry.
The commonest neurological manifestation is a spinal DCS manifestation, loss of the dermatomal and myotomal distribution, where they presented with the bilateral lower limb weakness. Another clinical findings that we noticed that is based on not truly the by imaging is the inner ear. Most probable inner ear manifestation where they have the sharpened rhombic test positive. We just put them in the chamber because we don't have that imaging capability. But then we turn out that post hyperbaric oxygen therapy, especially after 3 cycles, most of them recovered from this instability by looking into the probable of inner ear manifestation. In the present,
sorry, nak tanya. So you mentioned about inner ear manifestation. How do you differentiate that from, if I'm not mistaken, barotrauma also can cause that kind of like vertigo, sensory sensation.
Exactly. By looking into the clinical.
So how do you differentiate that?
It's actually looking into clinical. We can't differentiate truly, but we found that those patients that underwent the hyperbaric and showed improvement without having the obvious tympanic membrane injury, those patients is most probable only. As I said, we have the limitation as no neuroimaging being done. But then that is the reason why one of the things that we assess and we teach to the our colleague from the Ministry of Health, sharpened rhombic test might facilitate in determining certain clinical patient that is not truly neuro DCS, but they might be benefit if they get the treatment with the clinical hyperbaric.
Apa test?
Sharpened rhombic test.
So how do you perform that?
Ask the patient to hold, put in the tandem gate position and close their eyes for 30 seconds. And we allow them to go for the adaptation at least 4 times. If let's say they still fall, we put that as a sharpened rhombic positive. We put them in the clinical chamber immediately.
Oh, okay. All right. Ada lagi
So,
question. Ada lagi question.
in the presence of neurology deficit, should we get imaging? Obviously, we should get the imaging. The problem is that, as I told you guys earlier, in a certain center where you need to be friend with the radiology department. Some of them very good, some of them might be a little bit fussy, but I would say that if I have that, that is what we want. As I shared with the lecture earlier, what are the factors affecting the outcome of patient recovery? We found that the earlier they get the treatment, the better the outcome is. And the earlier, if let's say the first encounter by the medical doctors, if they put into the high fraction of oxygen as early as possible, put the patient into resting position and allow the IV drip to be delivered early, they have the better outcome as compared to those does not receive that first aid recovery, the first aid treatment. So Nina, need to ask question if one is suspecting DCS so that it can convey to the diving doctor involved for consideration of, okay, share what are the need to ask question, dive profile. I think those are the things that they want to know more. What is it truly DCS? But I would say that nowadays, if you're just suspecting DCS, we say that send over, we'll do the reassessment. Okay, is that answering the question, Nina? Hopefully.
Yeah. I think maybe you can elaborate a little bit more because kita divers we know what to ask the dive profile. Yeah, because we have medical officers from ni kan dia kata dive profile apa benda tu kan.
Okay.
Yeah.
The main three things is about what is the maximum depth, how long is the duration of the dive, and number three is when is the onset of the manifestation. This will determine the important and urgency for us to prepare the chamber. Like those patients yang I shared earlier, I think doctors in Kota Kinabalu, they know that they want to get an early treatment. They immediately say that, doctor, this is very emergency. I have the cash. Never mind, just send over the cash. We know that. We do understand that it's cash, and we get the treatment as early as possible. Okay. Once person diagnosed with DCS, when they can be allowed to dive again? That's a tough question. But I would say that based on the current discussion, I think the CEO of the Camofins did mention before this is actually they have to be reassessed prior to dive. Some might need to up to 2 weeks duration before they can allow to be in that kind of environment again. But then if they have this, what we call the permanent contraindication of diving, like the suddenly noted to have this like pattern foramen overlay, or maybe perhaps with a certain cardiac condition that, or maybe lung pathology as a coincident finding from the previous injury, they might be permanently disallowed from to go for the diving environment. So one last question, who else can we contact if we are suspecting DCS? I think if you're in the Pantai Timur, you can contact Prof. Nick. Prof. Nick is the best referral for us. And if let's say encounter in this region, all military emergency physicians would love to facilitate and give the support to our colleague from Ministry of Health or Ministry of Education for that. Okay, is there any factors in diving technique that put the patient more at risk for DCS? He's Safwan, he's a diver. Hi, Safwan. Third one, long time for not seeing you. Okay, any factors in diving technique? I would say that there is no specific techniques. It's just that if you are clumsy underwater, you are actually prone to develop DCS. If you're calm as what we call the lake water, then I would say that most of the time, you know what you are doing, you are less likely prone to develop DCS. It's about the pressure gradient changes, the adaptation, and the way of your diving and the technique. If you are breathing like a buffalo underwater, that is the first sign. The dive master will say that I have to be cautious with this diver because he might give trouble with me of developing DCS. Okay. Really last one. Okay. The risk. Will you still recommend people to try diving spots? Yes. I would love people to try diving sports, because that is the way we know that Allah said in the Surah Ali Imran, Rabbana ma khalaqta hadha batilan subhanaka faqina azabana. There is nothing that Allah create as something here, or you just enjoyed it. Okay. Hopefully that will answer the question. All right. I think with that, I will love to give the mic back. Thank you so much to organizing committee. Thank you, everyone.